Leading our news tonight with the One Big Beautiful Bill Act now signed into law, NBC Montana is working for you, taking a look at how Montana might be impacted. Our investigative reporter Bowen West dives into the cuts to Medicaid and what this could mean for rural hospitals.
The new law places new work requirements on childless adults without disabilities, as well as lower provider taxes. The Montana Healthcare Foundation is a nonprofit that uses data from the Department of Public Health and Human Services, Kaiser Family Foundation, Montana Hospital Association, and more to evaluate how Medicaid really impacts the state each year. According to the CEO, the impact will be felt over the next decade.
Looks like the state will lose over the next 10 years roughly $5 billion in funding for healthcare services. So hospitals, especially the rural hospitals, provide emergency care for anyone who comes in.
The Montana Department of Public Health and Human Services reports over 215,000 people are enrolled throughout the state. Montana Healthcare Foundation is estimating 30,000 enrollees will lose coverage through the new provisions. Data shows this could lead to a decrease in expanded programs at rural hospitals.
If we see a big reduction in the number of people with insurance to pay for that kind of service, we may see some cuts in services as well.
Too much spending on Medicaid is a common sentiment by members of Montana's congressional delegation. Congressman Ryan Zinke took to social media where he said the work requirements strengthened the program, an opinion Senator Steve Daines shares.
There's been a lot of waste and fraud and abuse introduced into Medicaid. It's increased in spending by 60% in the last 5 years. So we need to put some reforms in place that make sure this important safety net is around for many years to come.
There may be a lifeline. $50 billion in relief funding is set aside for rural hospitals. Nothing is determined on how that money will be used.
I'm sure there's like some sort of complex formula of how that's spread out. Is that?
Yeah, there will be. They'll be looking at needs in the states and per capita and so forth.
According to data from the American Hospital Association, 48% of rural hospitals operated at a financial loss. In that same study, they say Medicaid paid rural hospitals approximately 63 cents on the dollar for inpatient care.
Have unique challenges with staffing, with trying to keep the doors open, the lights on, but very, very important to have that access to health care in Montana in some of our very remote areas of our state.
Montana Healthcare Foundation says things are still up in the air. It's too early to predict if this will lead to rural hospital closures.
Success of this is really going to hinge on the state's ability to implement efficient systems to make sure that they are able to accurately determine who's working or who's exempt from those work requirements.
Reporting in Missoula, Bowen West, NBC Montana.